Hello and welcome. Welcome to the Wellness Institute's uh, low back pain tips for self-treatment. Glad you could join us today. My name's Karen Whalen and I'm the host of today's webinar. Today's webinar will be facilitated by Carrie St. George. She's a physiotherapist here at the Wellness Institute in our Sport Injury and Rehabilitation Clinic. Carrie is a graduate. Just to give you a bit of background about her, she's a graduate from U of M with a bachelor's of physiotherapy, and she also has her master's in clinical science in manual therapy from Western University. She enjoys working with many different clients, those with spinal pain and also those with, deals with a lot of people with low back pain. So she's well versed in the subject matter she's going to present today. Just to give you a little bit of background about the Wellness Institute. There you can see a picture of the Wellness Institute. We were established in 1996, so we've been around for a long time, over 20 years. We're a not-for-profit certified medical fitness facility right here in Winnipeg. We offer personalized fitness, nutrition, and lifestyle change programs, and our aim is to prevent illness and help improve quality of life and enhance health outcomes. Just to note, if you have any questions before we get underway here, if you have any questions during our webinar, please put them in the chat box on your screen at any time during our presentation, and we'll address them at the end, just to keep with the flow of the webinar. I'm now going to turn things over to Carrie. Here she is.
Welcome everybody to my presentation on low back pain tips for self-treatment. Today I'm going to discuss with you a few common types of back pain and some self-treatment ideas to help you manage. Low back pain is a very complex issue with multiple causes and sometimes no cause at all. Treating low back pain is like a puzzle, and sometimes it takes a little bit of trial and error until you find what works for you. There is no one-size-fits-all solution. This is why there's no straightforward solution when treating back pain. A bit of disclaimer to start. This is an important note that it's important to note that this presentation does not replace a thorough assessment and individualized treatment plan by a qualified healthcare professional. During the presentation, I will go through some very basic low back anatomy so you get an understanding of the structures of the back. We will discuss 4 different general types of low back pain with their corresponding common mechanism of injury, common symptoms, and common things you can try for self-treatment. I will also briefly discuss prevention strategies for low back pain and a couple of recovery information tips. The low back comprised of 5 spinal bones called vertebrae, right here. In between each part of the bone, there is a disc, right here. The disc has a fluid-filled center, and the purpose of this disc is to help with movements of the bone, increase the height of the spine, and shock absorption. The vertebrae also come together in the back to form a joint called the facet joint, which is right here. This is where the 2 bones glide together to create movement of the spine. As the facet joints come together, they create a canal called the intervertebral foramen, which is right here. The nerves of the spine exit through this canal and travel down your legs. There are also many ligaments that hold the vertebrae together and create stability. And stability and mobility are also created by many muscles, large and small in the spine, including your core or stomach muscles. We could get into detail of the specific muscles and ligaments, but it would take the rest of our time, so we'll go on. The first type of low back pain we are going to discuss is a disc herniation. As I mentioned in the last slide, we have a disc that sits between two spinal bones. Inside the disc, there is a fluid-filled center called the nucleus. This fluid has some mobility to it, and when we bend forward, the fronts of the bones come together to create a wedging of the disc, and the fluid moves backwards. When we bend backwards, the fluid moves towards the front. Under normal circumstances, the fluid moves around with no trouble. So when injury occurs, the injury occurs to the outside of the disc through bending forward or bending forward while twisting with or without a load, it can cause the fluid in the disc to displace backwards, causing bulging or displacement to the rear of the disc. The fluid can cause irritation of pain-sensitive structures of the back, including the disc, nerves, muscles, or joints. This can cause pain in the back that radiates down the leg and travels down the leg. The best analogy I often use for this type of injury is like a jelly-filled donut. You bite into one side of the donut and the jelly shoots out the other side. So here, the disc, the nucleus in the center, is pushing out towards the nerve running out of the back, causing irritation. Common symptoms of a disc herniation include pain that is worse with sitting and bending forward. This causes increased pressure on the disc and further irritation of the structures mentioned previously. Pain typically radiates down the leg, and you can have numbness and/or tingling or weakness in the leg. It is really common to wake at night due to pain, and you often have increased pain with coughing or sneezing. It should be noted that if you experience the extremely rare symptom of changes to bowel or bladder function after a disc herniation, you should see a doctor immediately. A common type of self-treatment for a disc injury is called repeated extensions or McKenzie exercises. The goal with this exercise is to allow the nucleus to return towards the center of the disc, decreasing irritation on the nerves or joints. Ideally, we do this when we stand, but if it's too painful, you want to do it lying down on your stomach. So the standing one is this one here. When you stand up, you place your hands on your hips and you lean backwards, arching your back. You want to repeat this about 10 times. When you do this lying down, this one here, place your hands like you're going to do a push-up. Keeping your hips on the floor, push your upper body upwards like you're doing a lazy push-up. Again, you want to do this about 10 times. I will commonly have my clients do this exercise once an hour when they are awake and after they have been sitting or bending forward for a long period of time. The goal of this exercise is to centralize the pain, which means to bring the pain out of the leg and center it towards the low back. So with this exercise, if you had to color a picture of your pain, the smaller the area you color, the better it is. It is also common with centralization when it's occurring to have more intense pain in a smaller area, and this is normal and a good sign, and the intensity should diminish. It is important to reduce the stress on the disc, and you should modify the way you do some of your activities. No point in trying to reduce the herniation if you're going to turn right around and aggravate it again. If at all possible, you want to avoid bending forward to pick objects off the floor, putting on your socks, brushing your teeth. You want to keep your back straight. You want to bend through your hips and knees, like this person is in these pictures. She's bending through her hips and knees. When lifting or carrying objects, you want to keep the weight as close to your body as possible. The further out the weight from the body, the more stress it is on your discs. You also want to avoid sitting in soft chairs like a couch. This causes the low back to flex or bend forward. You want to sit in a straight back type chair like a kitchen or a wing back chair. You want to avoid slouching when sitting, standing, or using the toilet. You also want to maintain a small natural curve in your low back, and this will help with the disc. So you want to place a small roll of towels in the small of your back, which will help maintain the natural curve of your back when you're sitting, like this individual does here. She has a roll of towels in the small of her back. An important part of self-treatment for low back pain is exercise. A good comprehensive exercise program consisting of core stabilization exercises and hip exercises is important. I, for the most part, get my clients to avoid doing sit-ups to strengthen their core. This causes bending and it can irritate the disc herniation. You want to focus more on doing plank type exercises or dead bug type exercises. Unfortunately, this is a very large topic, the exercise component of it, and we won't have time to go in depth to it today, but we will be doing this in a future webinar. The second type of low back pain we're going to talk about is lumbar stenosis. Stenosis is the narrowing of the canals where the nerves exit and travel down the legs. So in this picture here, we have a couple of the foramen, which are normal size, and then we have the narrowing, the stenotic foramen. This type of back pain tends to be more common in older individuals. The canals can be narrowed by bony changes, like bone spurring, degenerative changes, or inflammation of the canal or nerve, which can make either the nerve bigger or the canal smaller. It can also happen when a person develops a forward slippage of one bone on the other, and which changes the shape of the canal. This is called a spondylolisthesis, and it is not as common as the other changes that I've talked about. General rule of thumb, when a person bends forward, the facet joints, so the spine joints, move and cause the canal to increase in size, giving more room for the nerve. When a person bends backwards, the canals decrease in size, causing compression or decreased room for the nerve. Therefore, in stenosis, bending forward is more conducive than bending backward, which is the exact opposite of movements that cause symptoms of a disc herniation. So it's important to differentiate how your symptoms, how you get your symptoms to help with certain treatments. With stenosis, typically a person feels better when they're sitting or when they're bending forward, and worse when they're standing or walking due to the changes in the spinal curves and canal size that I talked about. It is very common for people with stenosis to have limited walking tolerance. A person typically walks for a certain length of time before they have to stop due to pain. If they sit and rest for a short period, they can typically walk the same distance again before they sit down. A person with stenosis typically feels better walking when they lean forward, like when they're holding onto a grocery cart or onto a walker. This puts some forward flex in the spine, decreasing the compression on the nerve. So that is a common symptom. People say it feels better when I lean forward. Self-treatment for stenosis is geared towards doing activities that make the canal bigger and therefore decreasing compression on the nerve. Performing a posterior pelvic tilt can help. This gentleman here is doing the posterior pelvic tilt in this picture right here. You can either do this standing or sitting. You want to think of your hips and your pelvis as a bucket of water, and you want to roll your hips and pelvis backwards, tilting the bucket backwards. This will cause flattening of the back. So this gentleman here is the picture of the bucket. It's tipping backwards. If you do an anterior pelvic tilt, it tips forward, and if it's in neutral, the bucket is level. Another way you can think about it, and I often tell my patients, is to tuck your tail between your legs. So this gentleman's tail is going between his legs, whereas this one here, when he's doing the anterior tilt, his tail is being pushed up. A person also needs to take rest breaks while walking. Sitting down or leaning forward onto something will help decrease your pain. It is important to learn your walking tolerance and what your walking tolerance is, and try to keep your walking time to that tolerance. To determine this, it can be a little bit of a trial and error at the beginning. As you get stronger, increase strength and fitness, you can increase your tolerance. So for an example, let's say you have a tolerance for walking about 20 minutes before you develop pain. Now that you know your limit is 20 minutes, you can time your walk and take a break slightly before you develop pain. So sit, you have a rest for a little bit, and then you can carry on walking. So say if you wanted to do a 50-minute walk, you have to take 2 rest breaks to help manage your pain while you're walking. When you stand at a counter, if you put your foot up on a little stool or open the cupboard door and elevate your foot on the edge of a cupboard, this will help the pelvis go into a posterior pelvic tilt. So this gentleman here, he's put his foot up, when he's at the sink, he's put his foot up on the counter. That puts his pelvis into a posterior rotation and helps decrease the stress on his back. Another trick people can try is perching or sitting on the edge of a stool or a counter or at the counter or a workbench. You don't have to fully sit on the stool, but just at the edge, so you're halfway between sitting and standing. Again, this position puts you into a posterior pelvic tilt and can help manage your pain when you're at a kitchen or a workbench. So this picture right here, this person is, we call it at a sit-stand stool. So this person here is halfway between sitting and standing, so to help them manage their pain. Exercises are also important for spinal stenosis. Doing aerobic exercises is important, and modifying your exercises to avoid prolonged walking or standing helps. So you could do something like the recumbent bike, or at the Wellness Institute we have a new step machine that takes you into more of a sitting position, which can be more comfortable. You can also try aquatic exercises, and that decreases the effects of gravity on your spine. It's also important to strengthen your core to help support your low back, and doing posterior pelvic tilt exercises, which this gentleman is doing here that I talked about before, tucking his tail between his legs. Mechanical low back pain, or non-specific back pain, is kind of a catch-all term for joints or muscles in the low back that is a catch-all term, for issues in the joints or in the muscles in the low back or pelvis, and it usually has very little to do with nerves, disc, or inflammation. It's often coined non-specific low back pain. This type of pain people have can happen quickly, like something catches or locking. For example, waking up in the morning and having a kink in your back. It can also happen slowly due to prolonged or sustained postures or positions over hours, days, weeks, or even years. issues with the lack of flexibility of the spine or muscles, decreased strength of the low back stabilizers or your core muscles, and decreased strength of your hips can all contribute to this type of pain. Some common symptoms for this type of pain include stiffness in your back. Pain or catching is usually also related to specific movements, positions, postures, and activities, and usually abates when you avoid these activities. This type of pain usually comes and goes and is less likely to wake you up at night. Sciatica is another type of low back pain similar to mechanical low back pain. Sciatica is a general term for pain that travels or radiates down the leg. There are many different causes, and it's important to pinpoint the cause as this will aid in treatment. Conditions we talked about previously, the disc herniation, stenosis, mechanical pain, can all cause pain to travel down the leg. Pain can also be caused by knots or spasms in the muscles like piriformis or glutes. You can have irritation or pinching of the nerves due to disc, stenosis, or tight muscles, which again can cause pain to travel down the leg. Joints in your low back and pelvis can also cause pain to radiate down the leg. Due to the numerous causes of sciatic type pain, it can be very hard to generalize symptoms. A good, detailed assessment by a physiotherapist, athletic therapist, or a chiropractor is often needed to weed out the cause. Treatments for each cause is different and can't necessarily be generalized, but there are a few things you can try if you have sciatic pain to see if it can help you. Both with mechanical low back pain and sciatica, it is important to maintain flexibility of your muscles and joints. Many people with sciatica have tight piriformis muscle, which is that muscle is located in your buttock, and trying to stretch this muscle might help. For this exercise, you want to lie on your back, and using your hands, you bring your knee up towards your opposite shoulder until you feel a stretch in your buttock, which is this picture right here of this gentleman. It is important you keep your back flat on the ground and not twist. And the stretch should not be painful. If it is painful, just back off the stretch a little bit and don't stretch so hard. With this stretch, you want to hold the position for 20 to 30 seconds and do multiple repetitions. You could also try a knee to chest stretch, which this lady is doing right here. For this stretch, you bring your knee towards your same side shoulder. You also want to maintain mobility of the spine joint, so you can also try the backwards bending exercise that I described earlier in the presentation, which this gentleman is doing. Strengthening is also important for sciatic and mechanical low back pain. Muscles often get tight due to weakness in the core and hips. These muscles are trying to compensate for the job that they aren't necessarily designed to do. By strengthening your core muscles and hip muscles, you can allow the tight muscles to relax better and hopefully help decrease your pain. It sounds counterintuitive to strengthen your tight muscles, but it does help. So doing exercises like the dead bug, plank for core. You can try exercises like clamshells, bridging for hips and legs. Again, we will discuss this specific exercises in a future webinar. Few words on prevention. Various research studies have found that exercise was the only consistently proven effective preventative measure for low back pain. An exercise program geared towards strengthening your core and strengthening your hip muscles will help with not only treatment of low back pain, but prevention as well. It is also important that once your back pain settles, you need to continue with your exercises. Don't stop. I like to say you need to do exercises enough to keep your problem areas from being problems. A physio friend of mine came up with an excellent analogy. She said that your body is like your house. When you purchase a house, you don't just let it sit for years. You do maintenance. You cut the grass, you clean the floors, the bathrooms, change furnace filters, kind of etc. This is maintenance. Your body is the same way. It needs to do maintenance and to keep it healthy So exercise is maintenance. So you need to continue doing maintenance even after you have had your back pain has subsided to help keep your back healthy. Prevention also includes reducing stress on your low back. When you lift, you want to bend through your hips and knees and keep your back straight. So you want to lift through bend your hips and knees. You also, and this person here is bending forward to pick something up off the floor. Again, you want to bend through your hips and knees and keep your back straight. When lifting, you want to keep the load as close to your body as possible. Like I said before, the further the load is away from your body, the more stress on the spine and discs. You also want to avoid twisting through your low back. This person is twisting and she's not moving her feet. If you have to turn, you want to move your feet instead. So this creates less stress on your back. Your feet aren't super glued to the ground. You also want to avoid sitting and bending forward for prolonged periods of time. You want to vary up your activity and positions. A few notes on recovery. Recovery from a low back injury takes time. There are no quick fixes. It can take anywhere from 3 to 6 months or even longer to heal with proper treatment. Recovery from a back injury or any injury in general is a lesson in patience, and I'm learning this as I treat more people. Majority of the people want a quick fix to help with their injury. Unfortunately, there's no such solution. Your pain will get better, but it takes time and active participation on your part. A lot of clients have said to me that they thought the pain would go away on its own, and sometimes it will. But general rule of thumb is that if it doesn't go away on its own within 3 to 4 weeks, it most likely will need some help along the way. The longer you wait to seek help, often the longer it takes for it to go away. With any treatment, your active participation in doing your exercises is key to help with your pain. As healthcare providers, we can give you all the tools to help so you can help yourself, but unless you follow through, it may not change. Your pain is your own responsibility. So I hope that what I talked about today gives you some tips into possible treatments for your back. Try some of them out. If things don't settle, contact a healthcare professional like a physiotherapist, chiropractor, athletic therapist, and have a proper assessment done. If you've already had that done and have been given exercises, please keep on doing them. And again, for specific core and strengthening exercises, I'm working on a future webinar, so look for it, and we'll go through some of those. So thank you for your time.
Well, thanks very much, Carrie. We have time for a few questions, and I see a few of you have asked some questions. So, Carrie, I'll pose these questions that I have right now to you.
Okay.
Is there a type of, this person says, I have limited time. Is there a type of fitness program that is best to treat low back pain?
It's often just a few key exercises, and it doesn't have to take long to do, 10 to 15 minutes. So if you wanted to look up specific exercises, you could do like core exercises like we talked about, the plank or the dead bug, and do some repetitions of those, and doing specific hip exercises, some clamshells, some bridging. Like if you have a couple of exercises that you do regularly that take 10-15 minutes, those are easier to do than doing a whole long program. And the key is consistency, is trying to do them every day or every second day, and continuing to do them for, you know, I don't want to say the rest of your life, but that is the, to keep active the rest of your life with that.
Okay, and the other question I have, if I'm doing these self-treatment options and I'm not getting any better, is that when I should seek assistance of a healthcare professional?
That's exactly right. You want to, you can try a few things of these on our own. Like I said before, after 3-4 weeks, if what you've been doing at home hasn't been helping, you're better off to seek some help and get an assessment done. The sooner you get into an assessment, often the sooner things will start to abate. The longer you wait, often the longer it takes for things to abate.
Okay, and I have another question that just came through, is what are dead bugs?
Dead bug exercises are basically is you're lying on your back, and there's various ones, but your knees and hips are bent up in the air, and your arms are up in the air, and you move them back and forth while you're maintaining your core, kind of like a bug that's on its back and it's moving its arms and legs, and yeah, so that's what they call a dead bug. But if you Google dead bug, and look for pictures and videos, you'll find a whole pile of videos on it.
Make sure you Google dead bug exercise.
Yes.
Okay, I no more questions coming in. So if you have any questions that come up after the fact and weren't addressed in the seminar and the webinar today, please feel free to contact us. We're very appreciative of you joining us today, and we hope that you enjoyed the session and found it informative and helpful. This webinar has been recorded and you will be sent the link. So if you'd like to watch it again or perhaps share it with a friend, we encourage you to do so. We also hope that you can join us for future webinars too. So thanks again for joining us today, and hope you'll be back again in joining us in our future webinars. So thanks, and enjoy the rest of your day. Take care.